So if you recall, when we first started this lesson, we talked about observational techniques and then experimental techniques. The three that we've looked at so far, the cross-sectional, the case control, and the cohort studies, are all considered observational. Randomized controlled trials are true experiments, and if you've ever studied scientific method, this is the type of research or the type of study that you would have set up. So with a randomized controlled trial, you identify a population, or a sample, in truth, a sample of a population, and you take the participants and you randomly assign them to a group. In terms of the group, there's generally an intervention group. That's the group that gets what we call the treatment, gets the drug, gets the exercise, gets whatever it is you're investigating. So you have a group that receives the intervention. You have a group that doesn't get the intervention. That's called the control group. And then you may have another group that gets a placebo if it's a medication. So with a medication, you'll give a placebo like a sugar pill, because if you think about it, if you know you're going into a study and they're testing a drug and you're in the group that doesn't get the drug, you may be biased that you're not going to get better because you didn't get the drug. So by having a group that is just getting a sugar pill or something, a pill, but it's not the actual medication, it gets rid of that bias, or you at least have a group to compare to see if it's actually the medication or just the idea that people are getting medication that's making them feel better. The researchers and the participants are blind to their status. So with this type of study, the randomization is generally done by someone other than the researchers, because if I know that my subject is in a treatment group or in the control group, it may bias my observations. So the researchers and the participants don't know which group who's in, and that helps to reduce on bias. So with randomized controlled trials, first of all, the researcher creates their research plan, their data collection methodology, and that actually originally will go to an ethical review, an ethics review board. So we need to make sure that we are not harming human subjects. And so once that has been approved, the researcher will then find eligible patients or eligible subjects, and they will have them sign what we call an informed consent. This is where you are listing the risks and benefits of this research study. If the person doesn't want to participate, if they want to drop out at any time, those are all things that need to be offered to each of the participants. And after you have your pool of consenting participants, you randomly assign them to either the treatment or the control group. And then you study them over time and you see if there's a difference, if the treatment group had a difference in the outcome than the control group. So say with exercise, we can use that as a treatment. Let's say that I have a hypothesis that exercising 3 times a week, say let's do cardiovascular exercise, that walking 30 minutes 5 days a week will have greater benefits in terms of cardiovascular improvements than not exercising. So then I would have a group that exercises, maybe does their walking 5 times a week, and then I have a group that doesn't do anything, just whatever they want to do. And then I measure the outcome. Maybe that has to do with resting heart rate, and I see if my exercise group after maybe 6 or 8 weeks has a reduction in resting heart rate to a greater extent than the control group. So this is our traditional scientific method. Hopefully this isn't new to you, but if it is, that's okay too. But this is called a true experiment. So with regards to the strengths and weaknesses of randomized controlled trials, these are the gold standard in research. So a strong randomization will wash out biases. So what this what this speaks to is a large sample size. You want to make sure that you have, as many participants as you can get, because the more people you have in your sample, the less possibility of some kind of a bias where you're getting a result that is not truly an effect of the treatment. However, they are very expensive and labor intensive. My daughter used to work with drug studies, and they had very strict protocols that had to be followed, and she had to do so much paperwork to make sure that the FDA had the information they needed, and if they strayed at all from the protocol that had been approved, there was even more paperwork. So making sure people had the right labs going on and had the right medication, it's very labor intensive. The volunteer self-selection bias may make the study population not representative of the general population. So what that means is that you have to consider who might volunteer for this kind of a study. So if you think about an online survey, if you're trying to gather information with an online survey, one of the questions you have to ask is what kind of a person responds to an online survey? And are there characteristics of that kind of person that will bias your result? So if, let's say, you're doing a survey, you just want to find out about the number of people who have Wi-Fi, the number of Orange Coast College students that have Wi-Fi at home, and you send out a survey, well, the students that don't have Wi-Fi probably won't be responding because they don't have Wi-Fi. So that's going to create a bias in who actually responds, and this is something that you have to consider when you're looking at who responds. This does not reveal causation. Again, you're not looking truly for cause and effect here because you don't know if a person has a disease, but you are trying to find strength in terms of the relationship between a cause and effect. In the next section of this module, we will begin with reviewing the criteria that establish cause and effect.